So for those of you who just joined, welcome. This is Echo Asthma Bootcamp, Intensive Training in Severe Asthma Care. Today is our onboarding and welcome session. First things first, we just want to discuss technology and connection help. I know that most of us are used to living on Zoom these days, so it's not as relevant as it was, say, last year, the year before when we were having these. But just want to let everyone know the required technology for this program, like our ECHO programs in the past. We would like our modules to be conducted on the Zoom platform so that we have face-to-face interaction. So we ask, of course, if you're here on this call, you have access to Zoom. But please note that if you're using sometimes a phone or a tablet, it can be a little bit tricky to access some of the features on Zoom. So we ask that if you are, if you can, to type into the chat what type of machine you're calling in from. Are you, if you're on a phone, you can say phone. If you don't have access, you can just raise your hand and say, I don't have access. That's okay, but we do extensively use the chat feature throughout the course of the program. And we just wanna make sure that you see, you know where the chat feature is and you can use it if you need to. So let's see here. Hi, Dr. Majid. Erin McCarthy, hi, you're using your laptop. Nicole's also using a laptop. Excellent, excellent. All right. Feel free to add a couple of things in there. So can we get your real name, just your first name or a nickname for B9JWP9? Because that's a lot of letters and numbers for me to say. Thank you. All right. Thank you, Marlene. We'll change that. Perfect. All right. Well, thank you everyone for entertaining that one. If you are having connection issues, these are some good ways to get in touch with us. Again, I'm Ashley. Rachel is our Associate Director. Please just feel free to email us at echo.dkbmed.com. That goes to all of us. We will get the email if you're having any issues or you're missing emails from us, what have you. And then that's the direct line, 347-614-2680, okay? And you guys will have access to these slides and all the slides throughout the program at the end of the session, or rather we send everything out in a packet via email the next day, okay? So moving on here, I think now is a good time to just talk about the topics. We are gonna do a quick meet and greet with everyone. We'll get into the Project ECHO story, principles of Project ECHO if you're new to it, program outline, case presentations, and then we've already talked about technology and connection help. We moved that one up. So let's do our meet and greet. I'm going to stop sharing my screen. And like I said, you know, this is supposed to be a slightly different from the traditional webinar format. So our hub team will be on video. We want this to be as interactive as possible, as personal as possible, so that we all sort of get to know each other. So let's get back into our slide presentation. So we talked about it, profession, years in practice. Some folks were able to let us know. Have you ever participated in an ECHO program before? What do you hope to bring to your practice? These are things we'd love to hear from you in the chat. If you can access the chat and let us know. And then let's just really quickly, I'm going to stop my share again because the ECHO clap is very important. You will hear me and see me do the ECHO clap at the end of every session. It's just like this. We do a little wave, right? Yep, Tabitha's got it, Rachel's got it. So really, it's just a way for all of us who are mostly on mute, so unable to hear each other clapping. It's a great way for us to just say, thanks so much, we really appreciate it. And I always echo clap at the end because we always appreciate your attendance and all of your thoughtful insights over the course of the program. So that's our ECHO clap. Moving on. So what is Project ECHO? Marlene, perfect, exactly. If you can't have your camera on, a good old fashioned emoji clap is great. So what is Project ECHO? Project ECHO was developed by Sanjeev Arora. He is a liver disease specialist at the UNM Health Sciences Center in Albuquerque, New Mexico. He was frustrated that he could only serve a fraction of the Hep C patients in the state So he created this free educational model in order to mentor community providers across New Mexico on how to treat Hep C, because he was unable to physically bring himself to all of these outpatient and primary care clinics to treat these patients. So it's important that we know that this is not a telemedicine model. So our specialists will not be assuming care of your patients, but this is telementorship. So it's guided practice from our hub team as well as our group here, where the participating clinician, that's you, retains responsibility for managing your patient. The principles of Project Echo, I talk about our hub team, and this is what it means. Project Echo will link our expert specialists and they are the academic hub, with you, our primary care clinicians, who are the spokes of the model. So we all create a nice wheel there. Echo, it's important, is all teach, all learn. So we want this to be interactive. We want to see and hear you if we can. Raise your hand, shout it out. You can use the chat if you feel more comfortable with that. We understand, but it is helpful if you just kind of say, hey, you know what, this is what I would do in this situation. It is co-management of cases. It is peer-to-peer learning, and we want this to be collaborative problem solving. So program outline, just so everyone knows. This is what our each session format will look like. We will sign in the afternoon if you're somewhere around the East Coast here, and we have our polling questions, our pre-test for that day. We will have a 10 to 18-minute lecture at the start of each session. The biologics section is pretty dense, so that one's about 18 minutes long, but most of the time they're a tight 10 minutes. Then we have a Q&A. We have our key points from that lecture, especially this, which is especially important for this group, because this is when Dr. Jassel will really talk about what's important for the pediatric population, and then have Q&A. So if you have any questions about what you just heard in the lesson, that's a great time to talk about it. Then we have our patient case review, our patient case presentation, and then the co-management, sort of what would you do in this case? We're asking our, the core question of the presentation is, what am I supposed to do here in this case? What's the next step? That sort of thing. And we want to make sure that we cover that. Followed by a post-test at the end. And then, as I said, we'll just ask, some housekeeping items. Does anybody have any case they want to present next week? And so on and so forth. The modules are as follows. Defining severe asthma will be next week, followed by phenotypes of severe asthma. We break this into two so we can talk about endotypes and biomarkers in week 3, which is technically week 4. Then biologic treatment options, shared decision-making, which is a great one. We have a wonderful social worker who is trained in, he talks about needle fear. It's a really great session. Everybody really likes shared decision-making. And then we talk about managing injectable medications, because that's something that needs a little bit more in-depth review, especially when we're talking about biologics. So let's talk about case presentations for a minute. This is what the format looks like. So the spokes will volunteer a case. Hopefully you have someone who you've been working with and you maybe are a little stuck on something and you want to have a little bit more information about them. Or, this was an old case that you had and you wish you'd had a little more expertise for that. And then you'll present your case, you'll fill out our case form, which I'll show you in a moment. You want to include any lingering questions about managing your patient. And please keep in mind that your case does not need to align with the lecture content of that week. In fact, it's better if it doesn't really, because they're two sort of separate things. It's really just the best time to help manage your asthma patients. This is really your time to go through and say, hey, what do we do about this, right? So this is what the hub team will do. This is sort of their cadence. They'll summarize the case after you present it. They're going to ask any clarifying questions that they might need. We're going to ask for recommendations from your peers. They're going to make their recommendations, and then we're going to do the summary of the recommendations. That's very formal. It doesn't always happen exactly like that, but that's the idea, and that's how we're going to try to set that up for you. So I'm going to stop sharing this screen for a moment so that I can actually show you what our case presentation form looks like. So this is it, okay? We've got a lot of information on here that you can add, some stuff that you might not need to. This is one of our adult patients, a 66-year-old female, right? So asthma symptoms, frequency of symptoms, you know, this is really a review of your patient, everything that's been done, history, asthma controller medications. An important one, of course, is going to be adherence all the way through this course. Grading severity, family history, we're going to do the review of systems, lab findings, diagnostics, and then of course, like I said, the primary question about this case is extremely important. What do you really want to know about the patient that you're presenting? All right, so that's what the case form looks like. And we will get into a little more information about our website in just a minute, so hang tight. These are common patient identifier slip-ups. That's not a problem. We all know about PHI, no names, no locations. Please don't use birth dates if they're greater than 89, employment, and so on and so forth. Just as a note for that there. Now this is really important to note, claiming credits and the Echo Asthma website. So we've really turned our website into a hub for your program resources. So when you go to echoasthma.dkbmed.com, you can take the session post-test and claim your credits for that session. So as you can see here, now you won't receive any credit for this onboarding session. We try to keep it short and sweet, but it is important to orient you to all the different features. But starting next week, you can claim credits for 1 hour of credit. And that's all you've got to do. You can click the claim credit button, the post-test will pop up for you, and then you can print out, download and print out your certificate, okay? If you missed a session, you were busy, you had to miss that session, you can view our recordings of that week on YouTube. They are private links, so no need for anyone to worry about them being splashed all over YouTube. They're private. You can only access them if you have the link. You click watch session, and then you can come back and claim credits. And we can see that you watched it on YouTube and that you claimed credit, okay? So there's no reason for you to miss one and feel like you missed out. And then also, we send you the video from the week before, from that week. We send you the slides, and we send you like any major resources, but we've kind of stopped doing that because instead what we're doing is we've created a resource page. So let me show you what that looks like. We're going to kind of look at our website and show you how to navigate that. So this is what our website looks like. You've already seen it because you've signed up, right? The schedule page is where you're going to see the the claim credit button, or the watch, the view watch webinar button. So you click claim credit. See, here you go. So I haven't actually taken this one yet. Most of them I've taken. But this is what happens when you click claim credit. The post-test will pop up for you. You click submit. If you pass the post-test, you'll be able to attest for credit. The resource tab here is very important because we've got a lot of information here. The case presentation forms. So in this case, you'll download the pediatric severe asthma presentation form. You can just click that, download it, fill it out, send it back to me. And we can talk about that more as the weeks go on. Helpful links. One of our asthma educator, Andrea, is wonderful, and she always is a wealth of information, and a ton of resources come through her. We have the asthma home visit programs, Green and Healthy Home Initiative, copay assistant programs, teaching tools, how to clean a nebulizer. We're in some clinical resources on vocal cord dysfunction. So we're in the process of sort of cleaning this up and making it a little bit more user-friendly, but feel free to just go through there and really pick out any resources that make sense to you or that you saw we used that day. Because at the end of every day, we take all of the resources that were maybe mentioned in the chat or things that we've talked about, and we add them in there. All right, so it's nice to see we have a few more folks who have joined us. Hello, everyone. So that's our website. Our website is a very important resource for you. Make sure that you get familiar with it so that you know how to claim credit and so that you can access those resources at the end of the day. If you've not completed the program pretest, which is unlikely, we shouldn't have had any issue with that, but this is the website, echoasthma.dkbmed.com. Even echo.dkbmed.com will take you there, both route to the same website. But if you, for some reason, you haven't taken the pretest, please sign in. You'll have to log in each time with just your email address, and then the test should pop up when you're done there. All right. So that's everything for the onboarding session today. Like I said, we keep this one pretty short and sweet, but we want to make sure that you understand what's expected, what you can expect from us. Does anyone have any questions about the format or any aspect of the program just yet? All right, so as promised, does anyone have a patient that they would like to discuss next week? Anyone who's been giving you trouble or gave you some trouble in the past and you want to discuss and get a little more information? Nope. All right. Well, that makes a lot of sense. You know, it's the first session. We don't really know what the format's going to look like just yet. So when next week we'll have one of our hub team present, we'll have Dr. Jassel present a case, and we'll go through the format so everyone gets comfortable with it. And then hopefully by next week, we'll have some folks who are interested and willing to present a patient case. I see that we have a couple of people who just joined. We are just finished up our onboarding presentation, so we're going to be sending that out to you via email. So don't worry, you can kind of take a look at what we discussed today. But we are done with our session for today. Next week, we'll start we'll meet our hub team. We'll get to know you guys a little bit more, and we'll get to talk about defining severe asthma. All right, so please feel free to reach out to us with any questions if you have them. And of course, as promised, echo clap. Thank you everyone for joining us today. Thank you so much, Janet, appreciate it. Thanks everybody. Thank you, Marlene. All right, well, we're excited to have everyone here. Thank you so much for joining us. Thank you, Dr. Oliver. We'll see you next week to talk about defining severe asthma. All right, thanks everybody. Bye-bye.